Hi and welcome back to another video of Medic Notes. This video is on aortic regurgitation murmur, which is a diastolic murmur. It is a high-pitched, decrescendo, blowing diastolic murmur that is best heard over the aortic area of the precordium. It can be associated with any process that can lead to damage to or destruction of the aortic valve. The more common causes are rheumatic valve disease, bacterial endocarditis, connective tissue disorders like Marfan syndrome, and bicuspid aortic valve. Other less common conditions are age-related degenerative change, aortic dissection, syphilis, Takayasu disease, ankylosing spondylitis, and other inflammatory diseases like SLE and Reiter's syndrome. For its mechanism, the final common pathway for aortic regurgitation is damage to or incompetence of the valvular apparatus. This causes blood to flow back into the left ventricle in diastole. The characteristic murmur is the sound of blood moving back across the damaged aortic valve. The different diseases causing AR can affect either the valve cusps and leaflets or the aortic root, and are mediated by a number of immunological, degenerative, and inflammatory mechanisms, or else via a traumatic process. Whereas for dynamic maneuvers mechanism, the aortic regurgitant murmur is dependent on flow back across an incompetent valve. Therefore, in theory, any maneuver such as hand grip or standing, which increases systemic vascular resistance, will push more blood back across the valve and accentuate the murmur. When the patient squeezes hand grip, there is arteriolar constriction and increased systemic vascular resistance. There is increased backflow across the aortic valve, and the aortic regurgitation is accentuated. For the sign value, hearing an AR murmur warrants further investigation. Aortic regurgitation can be differentiated from pulmonary regurgitation by the fact that it occurs later in the cardiac cycle, which is after A2, rather than after P2 as occurs in pulmonary regurgitation. It is a valuable sign whose absence is a good indication that moderate to severe AR is absent. Its sensitivity and specificity in predicting moderate to severe regurgitation are 88 to 98% and 52 to 88%, respectively. The presence of a widened pulse pressure and collapsing pulse pressure with the characteristic murmur greatly increases the chance of significant aortic regurgitation being present. That's all for this video. Thank you.